Join Lee Bellinger today on the Bellinger Report. Lee is the publisher of Off Grid Confidential, one of the last information financial newsletters to be delivered 100% through the mail and completely independent of the internet and big tech scolds. Lee has been publishing continuously since 1988 and is your guide to off-grid living.
Hello, my name is Lee Bellinger. I'm a founder and publisher of Off Grid Confidential. And today I am interviewing Tony Cataldo. He is the chairman and CEO, president of GT Biopharma, which is now, do I have it correct? It's a NASDAQ listed company, yes?
Yes, that's correct.
And your stock is up to $10.
Yeah, that happens every now and then.
I hate it when that happens. And so I'll just go through the numbers here just for a moment because just so everybody knows, I was invited down to see your presentation in Miami recently, and they had a pretty ambitious invitation because it was all about a potential cancer cure with some breakthrough technology, and there was quite the briefing on it. So in a moment, I'm going to ask you a little bit about your company and what you guys are working on. But I see here that I know your share prices had gone up 413%, and now that you're on the NASDAQ now, so that's great. And you've done a great job of increasing the company's liquidity, and I guess you raised about $11 million in 2020.
It was actually 2020 $11 million. On the NASDAQ listing happened February 11th. We raised $28 million.
Okay, then I stand corrected. So Tony, why don't you tell us a little bit about your company? And just kind of recap what the remarkable findings that you shared with me and a number of other publishers and newsletter editors in Miami.
Yeah, Lee, thank you for the opportunity. We appreciate it. And a lot of this you've heard already, but your audience hasn't. So I'll start from ground zero. What I always like to remind folks is that biotech companies we try to deal in human health. So what I always tell folks is an investment into a biotech company can serve two purposes. One, valuation, increase value of your capital invested. And that's great. And you want to make money. In biotech companies, you can also make a difference. So I always like to remind folks that the money that we raise goes into patients. And the other thing I say is, as chairman and CEO, we are programmed to tell you guys that we're the best things since sliced bread. We're better than the competition. We're invested into our own companies. What else do you expect from us? At the end of the day, I think CEOs talk way too much, and I don't think you should listen to us. I think with biotech companies, there's a lot of specificity. It's the data, all right? It's human data, human FDA clinical trials. And whatever that data is telling you is what you need to listen to, not the CEO. And it's our data that has really caused the huge jump in valuation since the beginning of the year and previous to last year as well. And that is because we are in an approved phase 1, phase 2 clinical trial. We're almost at the end of phase 1. We'll be finished with it by the end of May, which means we should start our phase 2 portion in June, worst case July. And that's a big milestone for us. We've hit a number of big milestones here recently. And that's what I view my job to do, is to keep executing. Don't make any excuses. I've heard many excuses for failures. I just never heard one excuse for success. So I don't like excuses. And just keep making sure that, you're putting in front of people things that they can actually make a decision on based on informed information. And that's what data represents. I started a company previous to this that did really, really well. And I get a lot of credit. I was that guy that went from idiot to genius overnight. Mm-hmm. I started a company called Iovance Biotherapeutics. Started that back in 2011. It's now a $5 billion plus market cap company. And it's got that way based on data. All right. Yeah. For stage 4 melanoma patients in a regimen called cell therapy. And when I left, and I'll get to what the trike is, this is my segue to that. When I left Iovance, everyone thought, well, Tony's going to start another cell therapy company. I love cell therapy and I hate cell therapy. Cell therapy does work, but it's the most expensive thing you can do in biotech is a cell therapy company. This was an immuno-oncology company, just as GT is as well. And the economic model I wasn't really happy with. It's $1 million to $2 million per patient. It's so it's very expensive. And that limits the amount of patients that you can treat, because insurance companies are really difficult to go ahead and cover those types of high-end ticket items, as well as the ergonomics of it, the patient experience. It's not really a drug. It's a therapeutic regimen that includes all kinds of things. And then the other part of it is the physician experience. It's hard to administer as well. And I just felt that immunotherapy needed to go into a more off-the-shelf strategy where, the economics are much different, particularly if you could get cell therapy to act more like a small molecule drug. So I focused my efforts on my next technology company on the trike because of that. The trike is a small protein biologic. It is a real drug. And just to give your audience, a perspective of scale, if a molecule is the size of the planet Earth, a small protein biologic is the size of a satellite. It's very tiny. But in biology, tiny is really good. It gets you past the blood-brain barrier into the bone marrow and a lot of other places that small proteins can do. And it really is it's a targeted immunotherapy, which is where I felt things were going. More specifically, it's really focused on NK cells, which your immune system.
The hunter killers.
Yeah, they are. NK cell, people are very familiar with T cells, right? Because a lot of companies have been formed based on T cell therapy and T cell technology. There's two parts of the immune system, right? There's the adoptive side where the immune system creates B cells and T cells. That's where T cells come from. And then the innate side of your immune system is where NK cells are. T cells are more like soldiers, right? They see a foreign invader like cancer. So they very quickly the immune system says there's a foreign invader here. You got to send the troops out and try to get rid of that. It could be a problem. And T cells go en masse and they try to do that. But just like soldiers in the field, T cells can also become a problem in that if they're overexpressed, they can transition into a cytokine, and they can a cytokine's poison. They can actually start hurting healthy cells, not just hurting the cancer cells. And that's not a good thing. And so there's a lot of T cell therapy out there. NK cells are really much more prolific. They're the generals. They're the strategists. They also are extremely dangerous. They kill cancer, but if an NK cell is not target directed, it kills everything. But it is the most effective cancer killer. That's why they're called natural killers. And what the trike technology, and again, I love data, right? So I was following the data of Dr. Jeffrey Miller. Dr. Jeff Miller is the world's foremost authority in NK cell technology. Any NK cell technology company, whether it's an NK cell engager, companies like Affimed, Dragonfly, Innate Pharma. This is a different Dragonfly. It's Dragonfly Therapeutics. Or NK cell therapy companies like Nkarta, Cellularity, Fate Pharmaceuticals, Fate Therapeutics, Fate is a $10 billion market cap company that is a cell therapy company, again, with the big economic issues that cell therapy has. And by the way, that technology was developed by Dr. Jeff Miller, who's our chief medical officer. It's his older technology. It works fairly well, but it's still limited because of it's a cell therapy and its massive cost and side effect profile. So his next generation technology is the trike, tri-specific NK cell engager. The trike is a target-directed NK cell technology. And it is able to, I felt that the next wave of future, when I started Iovance, no one knew what cell therapy was. We were the leaders in that and caused a really huge marketplace to ensue. But I've just felt the next wave of excitement, next wave of therapeutics is really targeted immunotherapy. So I started the company in 2014, acquired the rights for the trike technology because the trike is a small protein biologic. It's a drug. That means the economic issues that you face with cell therapy aren't there. Instead of $1 million to $2 million per patient, you're now at that $100,000 to $200,000 per patient, where insurance companies can cover it. You're also not limited to stage 4 patients with the trike. Stage 4 patients are who we put in our trials. The FDA requires you to put end-of-line patients that have failed everything. We'll get into that in a moment. But it's also, the trike is able to come in earlier on the cycle as well. And it's a very economical and efficient system. More importantly, it's the data, right? That's happening. That's gotten us a lot of excitement and getting analyst coverage. And it's why Lee put me on the TV screen today, or computer screen, have you, because we're executing. And I think my job as a CEO is to, like I said, not speak too much and just execute, just deliver. And so we've been doing that. The clinical trials are the important part of a biotech company. In our phase 1 clinical trial, we were a bulletin board company a little over a month ago, and now we're a NASDAQ company. And it's because I really waited purposely before I uplisted us on NASDAQ until I had human data in an FDA trial. Because this way, there's no ambiguity about who you are. You are exactly what your data says you are. And so when I build a company, I look at 5 building blocks for me. One is data. I say it probably way too much. Number 2 is you have to protect that data in the form of your intellectual property. Your patents have to be really, really strong. Now, I get asked by a lot of other CEOs now, because I'm now a guy with pedigree. Who would have thought?
Who'd have thunk it?
Right. And they go, what's important? I go, when you're building your patents, you don't go to the lowest biotech bidder. You get what you pay for. We use Dr. Lisa Hale out of DLA Piper, probably the number 1 patent attorney in the world. And at $1,200 an hour, it's worth every penny. You spend the money there. I don't like holes in patents too, because companies like us become ideal candidates for big pharma to buy. And when big pharma comes in to look at you, the first thing they're going to look at 2 things: data and your patents, number 2. And if there's a hole in your patent strategy, they find it, you get devalued for it, or you may not even be acquired. So
that's right. The most expensive lawyer is the one that undercharges.
Exactly. I'm going to steal that and use it in my presentation and make it mine.
Actually, do you want me to tell you who I stole it from? No, that's okay. I'm not going to give that up.
Number 3 in my top 5 is the only customer that matters, guys, is the FDA. If you can't make that customer happy, you're going nowhere. Doesn't matter how great your data is, how strong your patents are. You have to be able to matriculate these assets through a successful FDA trial. Number 4 is boots on the ground management experience. There's a lot of nuance to this. I feel like I've got like 3,000 years of experience. And number 5 is capital. It takes a lot of money to do an FDA clinical trial, to build a biotech asset. It's expensive. And that again goes back to the economics of the trike that I like. So let's talk about the human data. All right, the thing that really matters.
Yes, because like one of the things I was interested, I guess you're kind of segueing into that now, but at this first stage of human testing, basically you just want to make sure that it's not going to hurt anybody. And yet you had some efficacy, an indication of efficacy at the early stage 1. And I think that kind of tweaked my attention, because it was unexpected at that stage. And so make sure when you go through this next step of discussion, just kind of touch on that, because, just so you know, Tony, a lot of my subscribers and the people who watch this report, most of us are over 60. And so it isn't just about investment. It's also about, is somebody going to crack the nut on this? Or is somebody going to help crack the nut on cancer? I mean, where's the innovation coming from? And so, of course, when you sent me an invitation, I was quite interested in hearing what you had to say, but really as much as, where we are on cancer research.
Well, look.
And so I appreciate, anyway, I wanted to put a little bit of context in there, because this is a lot to absorb for an audience, but for people over 60, when there's money involved and there's cancer cure, potential cancer approach that might be more efficacious than what we've got now, we're all ears.
Yeah, absolutely. And just to let you know, brethren, I am over 62, so I can relate to what you're...
I would never have guessed it.
Yeah, I got that, oily Italian skin kind of thing going for me. So the data, right, which is important. The trike is what's called a first-in-class, first-in-human clinical trial by the FDA standards. This is biology has never been done before. And I've had a kind of a track record of being able to matriculate those kind of things through the process. It's an expensive and difficult process. You have to understand there's a lot of nuance to it. When the FDA looked at the trike incorporates it is a small protein biologic. It's a drug. So like I said, it has those efficiencies. Inside of the drug is this thing called interleukin 15. IL-15 is a known cytokine, which is kind of like a poison for those of you who don't know what a cytokine is. But more importantly, is IL-15 has a direct symbiotic relationship to making NK cells excite and work. But the problem with IL-15 before the trike, most companies want to use IL-15 in the NK cells because it does do some pretty interesting things. But you can only use it at 2 micrograms per kilogram. That's a very small amount. That's called maximum tolerated dose. Above that becomes
maximum tolerated dose.
Right. Above that, it becomes a real problem and potentially could kill you. And so that's the MTD. So all companies trying to use IL-15 can only use it to that capacity. And there's a lot of side effects that come with it as well. A thing called cytokine release storm, which is a problem. In our trials, we've demonstrated that we can use IL-15 because it's embedded in the middle of our protein construct. And so IL-15 only gets introduced to the NK cell. It doesn't actually go to anywhere else. It doesn't hit any healthy human cells because it's target directed. So we're now able to use IL-15 at 100 micrograms per kilogram inside of our trike. But the important part of it is it causes NK cells to last. An NK cell, all right, only lives about 3 hours in your immune system. So your immune system is constantly having to regenerate these natural killer cells. The problem with that is when you're a stage 4 patient, you've gone through chemotherapy, bone marrow transplants, you name it.
You're very weak. You're way too weak to do any good with it.
Right. Your immune system has had the crap kicked out of it. Okay. And its ability to generate more NK cells is really problematic. All of the other NK companies, all of them except for the trike, and these are market caps of $1 billion all the way up to $10 billion. We're the lowest market cap, not because of our technology, because I was just uplisted a month ago. But people are starting to recognize that. That's why you're seeing our stock really start to jump significantly, and more to come. I'll get into that at the end. So what happens is our ability to evolve IL-15 in ways that have never been biologically done. The FDA went, look, we're concerned about IL-15 because we know above 2 micrograms, it could be a problem, and you're going to be dosing patients at much higher. So they said, look, we'll let you do the first 2 patients at 5 micrograms per kilogram because we're concerned about safety. And this is going to what you were talking about. Then they went, if you get through those 2 patients, we'll let you double it to 10 micrograms. If it's still safe, to 25 micrograms. If it's still safe, to 50. If it's still safe, to 100. If it's still safe, to 200. And at 12, the phase 1 portion of our trike trial is 12 patients. So it's 2 patients each cohort. At 5 micrograms per kilogram, when we bring a patient in, we check 2 things, major things. We check a lot of things, but the 2 major things are NK cells. Everybody's bored with NK cells. There is a rare case, like 0.0001,000% of people who are born without NK cells. That's a problem. But the rest of the population has NK cells. With these patients, because their NK cells and their immune systems are pretty trash, they're very low NK cells, but we test those levels. And then in our first trial, which is for acute myeloid leukemia and for MDS, myelodysplastic syndrome, they're blood cancers that express a thing called CD33 positive. That's a marker on all these leukemias. The trike is target directed. What the trike does is its construct consists of CD16, which is a receptor on an NK cell. That's a target for our trike to go attach to that NK cell. And then IL-15 is that symbiotic that NK exciter, all right, in the linkage. And then X, it's a platform technology. So our first trial is for leukemia and MDS. That's CD33 positive leukemia cancer cells. So we can program really, really well. Everybody in that landscape all of us try to do a similar thing. We try to get an NK cell to kill a cancer cell. All right. Because NK cells have a very short life. And so what everybody has a modicum of success in doing in their clinical trials right now is they add an NK cell and it kills the cancer cell. Once it kills that cancer cell, that NK cell is exhausted and can't do anything else. We're different. The trike's ability to take an NK cell, target directed into only that cancer cell, it does kill that cancer cell. But because of IL-15 and its ability, it causes, remember I said an NK cell only lasts about 3 hours?
Yes.
Causes that NK cell to last 3 months. It also causes that NK cell to do 2 other things, to also proliferate, to increase those exhausted NK cells come alive again because of the trike. And the third thing it does is it causes that NK cell to become a serial killer. When you guys have a chance, you'll go onto our website, look up the presentation, you'll go into about gtbiopharma.com.
Could you please name the website?
It's gtbiopharma.com.
Thank you. Say it again. Okay, good.
Do that.
gtbiopharma.com.
Section for the presentation, there's a video on there, I think it's slide number 12. It shows actual real footage in real time of an NK cell. What our NK cell of our trike NK killer. What our NK cell does is it not only kills that cancer cell and lasts for 3 months, but it becomes a serial killer. It continues to kill other cancer cells. It doesn't exhaust. It's got a longer life cycle. Nobody else can do that. It also causes more NK cells to come in, and they are more serial. You're creating multiple serial killers. So it's kind of the Hannibal Lecter of the cancer world in that it's killing cancer serialistically. So that's a big breakthrough. So on patients number 1 and 2 at 5 micrograms, their levels, you check their bone marrow blast level. That's the amount of cancer cells you have in your bone marrow, in this case for leukemia. And that patient's number 1 was at 10% and pretty much going up by 10% every day. These are stage 4 patients ready to die. They're at 6 weeks to 2 months to live. Tried everything failed. Bone marrow transplants, chemotherapy, other experimental drugs, nothing worked. So they're on our trial, and she came in, and at 5 micrograms, we didn't expect any activity whatsoever to happen because that's a very low dose, but that the FDA was being thoughtful and careful. That's what they should be. So we brought her into the clinic. Her energy level was low. She came in a wheelchair. By the end of the first, their trike is delivered in 3 to 4 day drug sessions, 4 days on, 3 days off, 4 days on, 3 days off, 4 days on. Kind of like dialysis, all right? By the end of the first 4 days, her energy level picked up and she didn't need assistance in walking anymore. She was like, I'm feeling really good. But we can't test her levels, or NK levels and bone marrow blast levels, leukemia levels, until 10 days after completion of the trike drug cycle. So sure enough, at the end of that, 10 days after she completed, we checked her levels, and her disease stabilized. It didn't progress. That's a win. In phase 1, that's unusual to see any kind of...
Right, because you're not trying to prove its effectiveness.
In phase 1, you're looking, what the FDA wants is to find out what the maximum tolerated dose is to where it doesn't start hurting people, and safety profile. So her NK cell levels, when we measured, went back to normal. That's why her energy came back. Her bone marrow blast stabilized, and there was no side effects. In leukemia patients and MDS patients, severe fevers, cardiac events, pulmonary issues. There's a lot of stuff that happens to these blood tumor patients. We had no side effects. Same thing with patient 2. Then the FDA went, hey, okay, no side effects. Go double the dose. And we doubled it to 10. Patients number 3 and 4, same thing. NK cell levels increased, disease stabilized. So we're like, okay. And then the FDA said, all right, now we'll let you take it to 25 micrograms per kilogram. At 25 micrograms per kilogram, we started seeing what's called efficacy signaling. That patient, remember, had very low NK levels, and that patient's bone marrow blast level was at 18% and went down. Instead of stabilizing, it went down from 18% to 12%, killing 33.3% of the cancer cells. That's unheard of in a phase 1 trial where you're starting to see cancer killing. And then we got to patient 6. Not every patient reacts to it. Patient 6, kind of the NK cell levels went back to normal, but the disease didn't decrease or increase. It was nothing. Patient 7. Now, patient 7 went up to 50 micrograms per kilogram. By the way, all the way through patients number 6, still not one side effect, not one fever, nothing. Patient 7 at 50 micrograms per kilogram. Now, remember, that's many multiples the amount of IL-15 that you can use that would be harmful to a patient. At 50 micrograms per kilogram, we actually saw what's called a complete response or a remission. That patient's NK cell levels went back to normal, and that patient ended up going from 12% cancer level blast in the bone marrow down to 4.6%. That's 66.7% killing of the cancer. That's a clinical benefit. That's a complete response. We presented that data. That's where our lives changed.
That's all in phase 1.
That's all in phase 1. We presented that data at a conference on December 5th, just a few months ago, at the ASH conference. The ASH conference is the American Society for Hematologists. They're 30,000 members strong, oncologists, hematologists, a lot of members there. Every biotech company, cancer biotech company, participates, hundreds and hundreds of biotech companies. They allow these companies to produce a poster or an abstract. So that you can present your data to people who are interested in hearing it. People will sign up to talk to you then. They pick 5 companies at the ASH conference to do an oral presentation to the entire conference. It was 4 big pharma companies like Celgene, Novartis, and us. I was a bulletin board company. Never been done before because our data was showing things that they'd never seen before. We presented that data in an oral presentation, and everybody woke up.
No pressure.
Yeah. So that was at patient 7, where we're showing a complete response. Since then, on February 11th, I decided, okay, it's time to get on to NASDAQ, to uplist the bulletin board. We did. We raised $28 million there, and our life's been crazy different. We got to patient 9 recently and provided that data. Patient 9 at 100 micrograms per kilogram showed that it increased the cancer cell killing by more. So that patient went down from 22% cancer level to 8%. That's 63.8%. So we're seeing progression of cancer killing.
Oh, yes.
Which you don't see in a phase 1 trial. You just don't. It's very rare. So now we're on patient 10 that started last Monday, doing well. We won't be able to present that data for another 3 weeks, but we fully expect that data to continue to progress the way we are. That will finish the cohort of 100 micrograms. And then we have 2 patients left on our phase 1 trial at 200 micrograms per kilogram, which will be done with sometime late May, which will allow us to send. Actually, we're approved for phase 2. We'll start our phase 2, which is a big milestone for a biotech company. We'll start our phase 2 trial in June, worst case July. And that's pretty significant. Since all of this has happened, we've been inundated by big pharma. I can't get into specifics for all the obvious reasons. One wanted to buy us right out the gate. I said, no, I'm trying to kick that can down the road. Our market cap value has increased from 40 million to about 280 million. We're still the lowest market cap in that space with the best data and not one side effect still.
Yeah, that's huge.
That's what I mean about forget about what people talk about. In data, and I hate to say it this crudely, there's no bullshit in data. It is what it is.
It is what it is. Tony, do you want to add? Our time has come to an end, and I wanted to know if there's anything that I didn't ask that I should have, that maybe perhaps you wanted to, a parting thought to people. And I think this, your briefing is a little on the technical side, but when it comes to the cancer issues, I suggest people replay this because you pick up a lot, and it's such an important field, and you have a unique approach. So it got my attention.
I guess I would add is that there's plenty of room for us to grow. Right? You got NK companies at $100 a share. It's easier to take a $10 stock to 100 than $100 stock to 1,000.
Yes.
Right. So But all of that will happen and should happen based upon milestone achievements. We got a lot of milestones that we're executing right now. We'll continue to do that. So put us on your radar screen, and don't complain to me if you end up buying at $30 a share. We did.
This is Lee Bellinger. I'm talking to Tony Cataldo of GT Biopharma. And I think I'm looking forward, and we'll pay close attention to phase 2. This is certainly a stock at minimum worth watching very closely. And I thought the presentation by Dr. Miller was awesome. I was a little intimidated to ask questions, but I did manage it. And as I suspected, his answers were larger than the questions I asked, and that was okay with me. But it was a very fascinating event. And I'm extremely grateful for your time today. I really appreciate you being here. I know that you got an extraordinarily busy schedule, and you made time for me, and I'm grateful.
No problem, Lee. It's good to see you again. All right. Thanks.
You take care of yourself.
Bye-bye.